kids earlier on, I think every mom here would love to know. I mean, it's always on the top of our heads, right? What would be your top tip for boosting a kid's immunity
It's the
so that they don't have to stay home, you know?
same thing. Yes, it's the same thing. All
Yeah,
right, so I'll just give you a quick and dirty tip. A lot of people think it's vitamin C. It's not. It's actually zinc. So I like this supplement called Immune Ped, which you can find, I think, in the you can find in doctors' offices, and you can find it like Thompson Medical, like pharmacy. IMMUNPED. It contains a very absorbable form of zinc, which you want to give your kid the minute you think that they're falling ill.
mhm,
However, to prevent that from even happening, then you have to attend my course on the 5 nutrients for yourself. Because when you're doing that for yourself, one of the lectures also includes food-based um, things to do. So you need to supplement if you're already in like nutrient debt,
that
sure. But how do you maintain afterwards? Definitely, we talk about the diet, and that if you implement for yourself, then you're probably implementing for your
for kids.
family, and so your husband and your kids are going to benefit from these nutrients as well. So the 5 nutrients that are most lacking in women are actually the 5 nutrients that are most lacking in children as well.
Right, right,
Yeah.
right.
So
Would
I'm
you
very
say
excited
so?
about
It's the
that.
same for men?
For men, a little bit different because men don't menstruate, so they're usually okay with their iron content. But yeah, I do
That's
find
true.
a
That's true.
few.
Mm.
So there are differences in men. However, if you're eating a whole food diet and you're having a iron-rich diet, they're not gonna, suffer from that.
Fall too far off,
Not
right?
that,
Yeah, yeah, yeah.
yeah, for sure.
Mm.
So this is great for people who are trying to recover their health. It's the first step. For doctors and coaches who are practicing and you want to learn about hormones and gut, but you don't know about the nutrients, I think you're missing a very important piece.
Yeah. And also for kids, I mean, these days there's so much talk about the microbiome.
Yes.
I mean, I have like the microbiome book from Dr. Robin Shukan and a couple of other books. So I mean, so much talk about the microbiome and how it
Mm.
affects our guts, and then gut health leads to everything. So then for the kids, would you say that really letting them get dirty, it's absolutely fine?
Yeah, I think that the kids are definitely too clean, but the problem with our dirt these days is also contaminated with chemicals. So if you go onto the soil and everything, it probably has anti-mosquito and it has pesticides on it as well.
Right.
So you must probably keep a balance of that. So for me, I like to bring my kids to the beach where there's free-flowing water and sand and air, and they're grounding as well to encourage the detox abilities.
Yes.
And we're not too fussy on dirt either, and we don't use sanitary. No, we don't use what do you call that, like the
Hand
alcohol.
sanitizers, right?
Yeah, we don't use that as much, but obviously in public places now you kind of like have to and all. So that's really important, and obviously the microbiome in the mom gets translated down into the child. So aiming for again vaginal delivery is one of the best things that you can do to seed the microbiome, and persisting with breastfeeding as much as you can as well is one of the other ways that the mom's microbiome gets passed down to the child as well. But we also must realize that our own microbiome in this generation, half a decade from the Industrial Revolution, is already altered,
Compromised.
compromised. When you've had antibiotics, it's compromised for at least 6 months. Um, and if you don't work on it, it's compromised for life. It's just changed completely for life. And so a lot of us have already a very altered microbiome, and it's really not as simple as taking a probiotic, because in
Right.
a lot of cases the probiotics don't stick because there are not any prebiotics to feed the probiotics with.
Probiotics,
Wow,
yes.
so a lot of people are lacking in their fiber intake for sure.
Mm. But
Yeah.
there are lots of people selling like prebiotics now too.
They are. So I guess it's okay. I mean, for me, for the average person who's not working on any kind of health issue, then I would say take it from your food and sauerkraut and fermented foods and fiber and all this, because it will
Fiber,
give you
yes.
a lot of whole food effects as well, and it will give you all the other nutrients too. and it reduces pill burden because you don't want to take so many pills and you start to feel ill. But with people who I'm working with intestinal bacterial overgrowth or IBS or autoimmune issues, then yeah, we use probiotics and prebiotics very therapeutically as well, according to the latest research, which I tell you is changing every single minute. So yeah, usually in those cases, I would seek my mentors who are at the top of their game in research, and I would be asking them. And at the moment, we actually agree we don't know an awful lot.
Yes.
So a lot of things that you see on the shelf is probably not really been that validated. Yeah.
I know. It's business as usual, right?
Yeah, right.